Health, the Executive Director, Florentine Obsesia, the Executive Director, Baylor, the Director, National Institute of Public Health. Colleagues, I want to welcome you to this 10th Uganda National Field Epidemiology and second Laboratory Leadership Conference 2024.
As we gather today, let's acknowledge the role field epidemiologists and laboratory professionals play in promoting health and well-being of the population, especially underscoring the role that the fellowship has played in recent years in responding to multiple outbreaks.
Field epidemiology continues to be a cornerstone of global health security, where we are looking at disease prevention, detection and control. There is no way you can do that without the workforce development piece that the National Institute of Public Health undertakes.
In Uganda, children account to 11% of all new HIV infections. In 2010, there were 20,000 new HIV infections among children, and in 2022, 5,900 new HIV infections. Analysis of the trends in HIV incidence among children is crucial in informing progress towards the global target of zero HIV transmission by 2030.
About 20,000 deaths are attributed to medical emergencies annually. And according to World Health Organization, a functional EMS can reduce preventable death by about 54%. To vitalize EMS in Uganda, the Ministry of Health launched the 2020 EMS policy and strategic plan. Among the key objectives were to increase the proportion of patients accessing on-scene care and ambulance use to 50% by 2025, and to increase availability of quality emergency care in all referral hospitals, district hospitals, and selected health center floors.
The consistently high mortality rates in Uganda emphasize the need for region-specific and disease-specific interventions. Langwe region consistently registered low mortality death rates over the 6-year period. However, mortality rates in the regions like Karamoja and Busoga are increasing, which calls for tailored interventions in the regions.
Globally, mortality due to vaccine-preventable diseases is declining. It has declined by 60% from 95 deaths per 1,000 live births in 1990 to 37 deaths per 1,000 live births in 2022. Vaccine-preventable diseases are mainly caused by bacteria and viruses. Safe vaccines against these infections are available and incorporated in the routine Uganda National Expanded Program on Immunization Schedule, and most are covered within the child's first year of life.
We recommend strengthening of malaria control in the country. We recommend targeted interventions to improve neonatal care, which would be crucial in reducing cause-specific mortality and in the long run enhance positive outcomes at regional levels.
We note that there is an urgent need for such programs in the country to train laboratory professionals, both in collaboration, in communication, in coordination and mentorship skills that are often underdeveloped in the traditional academic pathways. And I also want to underscore the critical role that you, the graduates from the Laboratory Leadership Program, play in strengthening the national laboratory system.
As the new Global Health Security Strategy highlights, sustainable health security depends on investing in resilient country-owned health systems. And the CDC remains committed to this vision through our global health efforts. We continue to leverage our expertise, partnerships, and resources to build local capacity in these areas.
I want to reiterate Baylor Foundation Uganda's pledge to continue supporting the Ministry of Health in fostering and advancing the laboratory leadership program. I also want to emphasize the importance of the collective effort in ensuring that the programs meet their intended goals and continue to thrive.